Hi everyone, I'm Ruth Francis, Enterprise Coordinator, based at the East Sussex Careers Hub at the County Council. Today we're going to find out a little bit more about the career of Ramesh, who's here from Brighton and Sussex University NHS Hospitals NHS Trust. Hello and thanks for joining us, Ramesh.
Hi there, hi.
Hi. So I wonder if you could start by just introducing yourself a little bit with your job title and an idea of what that involves.
Sure. So hi, I'm Ramesh. I'm a consultant obstetric anaesthetist, primarily a consultant anaesthetist here in Brighton. Basically what my job entails primarily is making sure that patients are safe and as comfortable as possible, comfortable and safe as possible when they're having an operation. Okay, that can either involve being fully asleep, which we call general anesthesia, or being awake but a numb part of the body that they're operating on, and that's called regional anesthesia. And by that, we give local anesthetic agents that temporarily block the nerves that supply pain and movement to that part of the body.
Okay, grand. So what does obstetric mean? Sorry, Ramesh.
So, obstetric is, I've specialized also into women having their babies and women in labor. So I have the lovely job of going up and providing what we call epidural analgesia, which is pain relief for women in labor, and also providing them the anesthetic if women need to have a cesarean section for their delivery. Okay. And also I would say that another big part of my job is, because of my skills, anaesthetists are involved in resuscitation. So that is people who have had severe injuries and have bleeding severely. We are involved in helping stabilize them and treating them, giving them blood and things. And also people with severe breathing difficulties that come into hospital, we're called again to stabilize and support them until they get better. And that includes people having a cardiac arrest.
Okay. Well, I know from having had an epidural myself that people are always really happy to see you.
Well, as I said, it is a really lovely part of my job, and I would fully recommend obstetric anesthesia as a career for every anaesthetist.
Yeah, fantastic. So I wonder if you could sort of talk us through a little bit about how you first came to join the NHS and to join the profession.
So I was always interested and quite good in sciences at school, and because of that I was fortunate to actually make a decision fairly early on, about age of 14 or 15, that I wanted to do medicine. I was okay at languages, but it wasn't really my interest, and although I would participate in sports, it was really never my thing, and I wasn't very good at it. So because of the interest in medicine, I then chose to do 3 sciences at A-level. I was fortunate to get good grades, and then applied to medical schools. At that time, we could apply to 5, and so I was lucky to get admitted to Guy's Medical School, which was a medical school in London. And that was a 6-year course, and then at my time you did 1 year as a basic general doctor. This is all in the NHS now, and then after that I decided that I would like to do anesthesia and intensive care as a career. Anesthetics is one of those what we call postgraduate specialties, which is you have to sort of train in it after you've done your basic medical training. Because I wanted to do intensive care as well, I decided to do a bit of medicine first. So I went to Kent for a couple of years and did general medicine to get an idea of what medical conditions are, how to assess people, how to treat them. And I then started my anaesthetic training in Bath and Bristol. I was there for 2 years, and then I was what we call a middle grade doctor, in anaesthesia for about 4.5 years in Birmingham, and then was appointed as a consultant anaesthetist in Birmingham, where I was for 13 years. And then, as with everything, my wife, who got a consultant post in Brighton, so we relocated to Brighton then, and I've been here for 9 years since then. And I have to say that as 30 years as an anaesthetist, I have never once for a second actually wished I'd chosen something else, and I'm very privileged and happy to be doing the work I'm doing now.
That is fantastic. So tell me what makes anaesthesia amongst all the different medical specialisms. Why is it so special to you?
I will admit that when I came to medical school for my interview at Guy's, they asked me why did I want to do medicine, and I said I wanted to help people. And actually, anaesthetics is one of those specialties where you know at the end of every day whether or not you've helped somebody. You go in to work in the morning, you have a job to do, you meet the people that you're trying to help, and then at the end of the day, as I said, you know whether or not you've done a good job or not. And it's such a lovely feeling just going home thinking, actually, I did help that or those people then. So that, I think anaesthesia is particularly good. Medicine is good for that always, but I think some of the other specialties, it's more of a longer term thing. You are helping people over days, weeks or months, whereas anaesthesia is very immediate, and that's what I do about it.
Yeah, you're making people feel comfortable, you're making them safe, like you said at the start. So I've seen behind you, there's a few sort of machines. I just wondered if you could give us a little insight into what those are and how you use them every day.
Sure. So this is my anaesthetic. This is our operating theatre. There's obviously nobody here. I'm dressed as I would normally be dressed in a day. To be fair, I would be wearing a hat and a mask on, but for my vanity, I wanted to show my best. So if I can show, this is my anaesthetic machine. This allows me to deliver the anaesthetic agents as well as to monitor the patients, because everything I do, I give can affect people's heart or lung functions, and I have to be able to monitor them and make sure that people are safe.
So, sorry, Ramesh, when you say agent, do you mean like a drug or?
I mean drugs or gases. Anesthetics involves both. We have drugs and drugs we give through a vein, or gases that people breathe that can make you unconscious or unaware. So anyway, so most of this is all monitoring and ability to deliver the gases and the drugs. There's an operating table where the patient would normally be lying on. And if I can show you some other bits of kit here, I have what we call a syringe driver. This is basically a bit of equipment that allows us to give drugs through a drip on a graduated basis.
Okay.
I have a blood pressure cuff. To be honest with you, if I couldn't measure people's blood pressure, it would be really, really difficult to do my job, because as I said, every drug I give has a potential to affect people's heart or lung function. So I need to measure that.
The cardiac side is really, really important.
Absolutely important.
Keeping people safe again.
I was also asked what essential bit of kit would I not be able to function, and I think probably because we deal with the breathing side of things in the airway, this is what we call a laryngoscope blade. Basically, it's a long word, but basically allows us to look down people's throats when they're asleep, to allow us to put a tube or another thing in so that they can actually breathe when they are unconscious.
Okay, so that blade part goes down the back of the throat.
Absolutely. So I would be putting it in people's mouths, in the mouth, yeah, around the back, so that I can see. It's a wonderful bit. We have much better technology now. We have filming systems and all sorts, but that is a basic bit of kit that we will still continue to use.
Fantastic. So obviously, yeah, it's a caring profession. We all know that. I'm just wondering, like, what kind of and you were saying you did science A-levels. I mean, what are the kind of skills and attributes that you need to kind of get in as a doctor to begin with, and then move on to specialise as an anaesthetist?
Yeah. So as I said, you trained first as a doctor. So to get in, as I've been asking, because obviously things have changed since I was admitted to medical school, what we've always looked for is somebody who shows initiative, someone who shows some leadership skills, organization skills, and who show commitment and enthusiasm. So for entry into medical school, my sort of advice would be, firstly, go to your careers teachers and ask what particular requirements are there now? Because obviously things change over the years and different medical schools have changed their sort of admission criteria. I believe there are now what we call extra tests now called the UK CAT, and there are a few others that medical schools ask people to sit before applying so that they have a result. Again, you have to find out from the medical schools you're applying to as to which ones they particularly want you to take. And also, obviously, they will be looking at grades from your GCSEs and from your A-levels. And they will be asking you to write a personal statement. Most medical students, schools do. And again, in your personal statement, you want to be showing those attributes I've talked about, you know, initiative, what you've learned in whatever you've done, and things like volunteering for a period of time. You know, we're talking about months rather than just the odd day here or there, and writing down what it is you learned from that. Sort of anything in sports that you've organized or led, anything outside that, you know, if you've organized a meal or something that you've done, basically, is what people are looking for.
Yeah. So it's not just about doing those science A levels. There's all these other things outside, like you're saying, volunteering, work experience, leadership, showing that you're working in a team, that are very, very important in a way for medical school applications that they aren't if you're applying to do some of the other subjects you might be applying to do at university.
Absolutely.
So really looking at the whole person, which makes medicine really interesting, I think. Wonderful, thank you. So for any young person who's thinking about how to develop the skills and experience needed to become an anaesthetist, you're still saying work experience, volunteering, yeah, any particular areas of volunteering or work experience they should look at, do you think?
I mean, being perfectly truthful, I think you all do all that to get in to do medicine, and then once you are doing medicine, you may have the odd chance of experiencing anaesthesia. As I said, most medical schools, you have very little exposure to anaesthesia until you've actually qualified. So I wouldn't concentrate so much on what you need to develop before you get into medical school, if you know what I mean. Yeah. The medical students that I see when they come into our theatres, what am I looking for? I am looking for somebody who shows enthusiasm, who shows an interest, who, you know, obviously knowledge is helpful, but knowledge on, you know, how the heart and lungs work, which you're all taught at medical school, and then how to apply it, because that's what we are doing as anaesthetists. We are actually using what we've taught to then adjust things and keep an eye on people's heart and lung functions, and if they're going awry, actually doing things to correct it. Yeah. So it's really, you know, enthusiasm, showing an interest. That's what I look for when I see medical students come to theatre, and those that I see, I tell them, do consider a job in anaesthesia, because those are the sort of people that we want to have. Yeah. But you do have to sort of, you know, be able to think fairly quickly on your feet in anaesthesia, because we have to sort of deal with things fairly quickly.
Yes, so need to be quick thinking and quite alert, I'm imagining, with all the machines beeping and colleagues moving around you. You wouldn't normally be just by yourself here, Ramesh, would you? You'd have several colleagues, I'm imagining.
No, you may be the only anaesthetist, but you're definitely working in a team. And again, that's something that I would look very much for, is the ability to work with other members of the team. A lot of the time you're the leader of the team, but also you are also part of the team. And sometimes you take the leadership from someone else on a particular thing that they have, you know, a particular a technical skill or an ability for. So it's definitely communication and working in a team. I would say you must be aware in medicine, I love it every second of the day, but in the whole of the NHS, out of hours commitment is probably the one that impacts most of us as in our personal lives, really, and that is we are here to also provide a service for our emergency patients, and therefore we do all provide a rota where we do work evenings and weekends, that means that there are going to be a very small number of occasions, but times when you have to be here at work and unfortunately you can't be at home. And when I'm at work, I love it. I'm very happy to do it. But as I said, I have to plan my home life around that a little bit. And that's why you need to be aware that that's something that you will be asked to do if you choose to do anesthesia as a specialty.
Yeah.
But there's always flexibility. Don't think you can't have a home life. Anesthesia, because it's a very much you've got a job this today and then it doesn't carry through. It's something that's very suitable for women or men who want to take sort of a part-time job for other commitments, whatever they are. So you can be very sessional in what you do.
Yeah, wonderful. Thank you so much. I'm just going to give some references for anyone who wants to find out a little bit more. So if you go to healthcareers.nhs.org and have a look at Explore roles, you can see under Doctor there's all the different specialisms there, and you'll find anaesthetists there. So that would be a really good place to start if you're thinking that what Ramesh has just shared with us is of great interest to you. So please follow that up. Ramesh, thank you very, very much for your time. It's been really interesting, and I think your passion for your job has really shone through, so which is really inspiring. So thank you very much indeed.
You're very welcome, Ruth, anytime. Okay, goodbye.
Bye.